Welcome back to Get Moving TV. Our next guest is Dr. Suhad Niazi. Dr. Niazi came to us and serves as the anchor pediatrician at the Pediatric Diagnostic Center. This means that she cares for the patients who are seen by the specialists and then followed up for every other test known to God and man. There's a lot of complexity there. What always impressed me, however, is that she really knows her well child care as well and brings to her practice a real passion for keeping children out of the hospital, out of the emergency room. Dr. Niazi, can you tell me a little bit about what's sitting right next to us right now?
Well, we have a car seat here, which is known as a convertible car seat. It can be used for infants as well as for older toddlers. For infants under the age of 1 year, it has to be rear-facing, and after that it can be used as a forward-facing car seat.
It looks pretty complicated and expensive to me. How much does a car seat like this run?
Well, they vary. You can find them anywhere between $60 and almost $300 depending on the brands.
Yeah, sounds like quite a yuppie car seat there at $300. What do you get, leather at $300? What do you get, extra safety?
It's just where it happens to be made and the brand name.
Well, that sounds good, but for $300, I mean, how much money are we saving? It doesn't seem like our children are.
All the car seats in the United States have to undergo some rigorous testing, and whether you buy a $50 car seat or a $300 car seat, it doesn't mean that your child is that much safer. It's really probably the bells and whistles that you get as part of the car seat.
Well, when I hear, when I watch an obituary in the newspaper, most of the time it seems to be neonatal deaths. Is illness and injury a problem for children in the United States?
Yes, it is. It's actually the #1 cause of mortality of children 1 to 17 years of age is dying in a car accident. Under 1 year of age, it's attributed to other illnesses. So car seat safety is quite an important feature to help prevent this.
What are the kinds, what is unintentional injury that pretty scary that's the #1 cause of death in children? You'd think cancer or heart problems or something else. What other kinds of unintentional injuries are there?
Again, the #1 cause is motor vehicle accidents, but then you have other things like drowning and severe falls.
So if I came into your office, what kind of advice would you give me as a parent? I mean, would you automatically just start rattling these things off, or how would you talk to me? How would you tell me how to prevent my child from dying from these unintentional injuries?
Well, looking at evidence-based medicine, car seat safety is one of the big things that has definitely shown to reduce mortality from motor vehicle accidents. In fact, when used appropriately, and that's the key, and we could probably talk about that in a little bit, properly used car seats can reduce infant mortality, so children under 1 by 70% and children between the ages of 1 and 8 by about 60%.
Oh my gosh, well, my daughter's 24 now. It's been a while since she's been in a car seat. You said something about proper use of car seats. You just throw them in, don't you?
No, not exactly. About 70% of car seats are actually placed in the car inappropriately. And sometimes that can actually be worse than not being in a car seat at all. In my training program, I took care of a lot of children who were put in car seats that weren't fastened into the car, for example, and they became a missile when the car hit another car and the entire car seat and child flew out of the car.
But is there any special features about this car seat? I know you were showing me something back in the back here.
Mm-hmm. Well, again, this is a convertible car seat, and this particular car seat can fit children anywhere from 5 pounds all the way up to 60 pounds. Your traditional convertible car seat will accommodate children up to 40 pounds. So a lot of you might have seen car seats with the handle that you can carry around. Those are infant-only car seats, and they're only to be used for children there's a couple of parameters. The infant car seats with the handles can be used for children under 1 year of age, and it can only be used rear-facing. The reality is most of our children these days are more than 20 pounds, and that's the other guideline, most of the infant car seats are only good up until 20 to 22 pounds, although there is a brand that now has an infant car seat all the way up to 30 pounds. But the rule of thumb is you need to be rear facing until you're 1 year and 20 pounds. And so when kids hit 20 pounds, but they haven't hit a year, they've outgrown their infant car seat and need a convertible car seat that you rear face until they're 1 year. And when they turn one, then you can turn it around.
And this kind of booster chair, what if I have an 8-year-old? Should they be in a booster chair still?
So that brings up another good point. We have reduced mortality in children between birth and up to 4 years dramatically by the proper use of car seats, because it's pretty much the law in most states. However, the booster seat laws are not widespread amongst the 50 states. There's probably about half the states that have booster seat laws, and they're very sporadic. The American Academy of Pediatrics, as well as the National Highway Safety Transportation Administration, recommends that children should be in some kind of car seat restraint until they're 4, 9, and 80 pounds. So again, your traditional convertible car seats, children outgrow them once they hit 40 pounds. This one happens to be an exception, and this one goes all the way to 60 pounds. But after 40 pounds, you can buy a booster-only seat, and children should be in that, again, until they're 4, 9, or 80 pounds. Now, in California, as of January 2002, they have a booster seat law saying all children should be in a booster seat until they're 6 or 60 pounds. So what's important there is what's the law isn't necessarily what's safest for your child.
We're here on the ocean. We certainly have a lot of swimming pools. You read all the time in National Enquirer, child drowned and then 30 days later comes back to life. How do we counsel people about the swimming pools and the ocean, and can people survive a drowning out here in California?
Yes, drownings can be very tragic, and an important thing to keep in mind is it takes a very small amount of water for somebody to drown, and children drown every day, even if they don't live in California. A couple inches of water in a bathtub or a couple inches of water in a bucket can cause somebody to drown, and there are children who have drowned from those very similar things. So the important thing is to keep an eye on your child at all times, and they're very quick. Anyone who has children know that within the blink of an eye they can be across the room. Things like putting gates around pools has helped this situation, but there's a lot of situations where kids get past that.
So an adult needs to be watching them if they're near a body of water.
Correct. And even if you have a gate around your pool, that shouldn't be a safeguard to say, oh, my child is safe from drowning, because again, there's malfunctions in the gates and some kids know how to get around them. So keeping an eye on them at all times.
What are the kind of safety kinds of things around the home? I know certainly every boy has stuck a key into the electrical socket. I think my molars are still fused together.
Well, if you go to any big baby store like Babies R Us, you'll be overwhelmed with the amount of safety equipment that there could be. I think two of the big things are, covering your electrical outlets with plugs to keep your child from poking their finger in there, as well as gates for stairs. Injuries downstairs can be pretty significant at the top of the stairs and at the bottom of the stairs as well.
How about gun safety? I know homicide you think of as people in their 20s. Do children die from injuries from guns?
Yes, that is another cause of injury as well as mortality for children. The frustrating thing about this is you can counsel kids all you want, but a lot of evidence-based teachings have shown us that kids still go for the guns. The NRA actually did a workshop with children about how guns are bad and you shouldn't be touching guns, and they spent an hour with them, and then they left them in the room an hour later and all the kids went straight to the guns. So I think the lesson to be learned there is if you do have a gun in the home, to have it safely locked up either not have it at all, but if you were going to have it safely locked up with the ammunition and the gun in separate places, and for the gun to be unloaded.